Okay, so we're diving into some pretty intense territory today, huh?
Hmm.
Severe traumatic brain injury. That's serious enough as it is. But what makes this deep dive even more high stakes
Yeah.
is we're talking about situations where you don't have a neurosurgeon on site.
Yeah, no kidding. We're talking about those critical moments where even minutes can make a world of difference. Life, death, long-term consequences. It's a lot.
And to guide us through this, we're turning to, well, you've sent over some pretty hefty excerpts. One's a consensus statement, right? From the World Society of Emergency Surgery.
That's right. And the other one is a recent review from Current Opinion in Critical Care.
So yeah, we're not messing around here. This
That's
is
the
the real
real.
deal. So before we jump in, what's the mission here? If
Yeah.
someone's listening, what's the one thing we want them to take away to help them in these incredibly tough situations?
The mission is really to give those on the front lines, the ones dealing with these situations day in and day out, the knowledge they need to make the best possible decisions for their patients. We're talking about giving these patients the best possible chance at recovery, and a huge part of that is getting them to a neurosurgeon as quickly and safely as possible.
It's like a relay race, almost. But instead of a baton, we're talking about someone's life.
That's a good way to put it. And one of the things that these papers really emphasize is the concept of a salvageable patient.
Salvageable.
Yeah.
Okay, I'll admit that's not a term I hear every day.
But
Honestly, it sounds a little, well, blunt.
it does, doesn't it? But it's really about resource allocation in the most dire circumstances. We're talking about situations where every second counts, and sometimes tough decisions need to be made. Salvageable in this context means the patient, with the right treatment, has a chance at some level of recovery.
So it's less about being insensitive and more about, like, focusing our efforts where they'll have the most impact.
Precisely. These situations are often about making difficult choices, and these papers are really designed to provide a framework for making those choices in a way that prioritizes the patient's best interests.
And speaking of frameworks, they keep mentioning this hub and spoke model. What's that all about?
So picture a wheel, right? Your facility, the one without the neurosurgeon, that's like a spoke on that wheel. The hub is the specialized hospital, the one equipped to handle these incredibly complex injuries. The goal is to get the patient from that spoke to the hub as quickly and safely as humanly possible.
Okay, so it's like a carefully choreographed handoff between two medical teams, often separated by, what, sometimes hundreds of miles?
That's a great way to put it. And one thing these papers really drive home is that communication between those teams is absolutely vital. We're talking about making sure the hub hospital is ready, that they know exactly what they're dealing with when the patient arrives. That could involve, let's say, checking on things like the availability of an ICU bed or giving them constant updates on the patient's condition, especially if things start to go south during the transfer. There's no such thing as too much communication in these situations.
I think a lot of people, myself included, would assume that the most important thing is just getting the patient to the neurosurgeon as fast as possible. But you're saying that the transfer itself, the way it's handled, that's just as critical.
Absolutely. It's not just about speed. It's about what happens during those precious minutes, those hours on the way to the hub. Both these papers are crystal clear. Stabilizing the patient for transport, that's non-negotiable.
Yeah, that makes sense. I mean, they're basically traveling with a brain injury.
Hmm.
So when we talk about stabilizing the patient, are we talking about the basics?
Yeah.
Airway, blood pressure, that kind of thing?
The basics, yes, but done exceptionally well. We're talking about meticulous airway control, maintaining blood pressure within a very specific range to make sure the brain is getting enough oxygen to begin the healing process, and doing everything possible to avoid any secondary insults, things that could cause even more damage. Things like letting those oxygen levels dip too low or having their blood pressure bottom out. And get this, one of the papers even goes so far as to say that ideally, the transport team should have at least a basic understanding of neurocritical care.
Whoa, whoa, whoa. So we're not just talking about paramedics here. They're practically a mobile ICU team at that point.
That's a great way to put it. We need those folks to be able to not only manage the patient's airway and vitals, but also potentially address any complications that might pop up during transport that are specific to neurology. I'm talking about brain swelling or, God forbid, even herniation.
Okay, so that's a huge takeaway right there for anyone who might be coordinating these transfers, knowing what to ask for, who to request. That knowledge could be life-saving.
You got it. It's about being your patient's advocate every step of the way, even before they reach the neurosurgeon. And it's not just about that transfer, right? Once that patient is in our care, we have to become their advocate. These papers dive deep into what they call brain-focused therapy, which I think is a good way to frame those initial interventions.
Okay, so we're talking about going beyond just keeping the patient alive, right? It's about like creating this ideal environment for their brain to heal,
Yeah.
even while they're being prepped for transfer.
Exactly. It's about minimizing any further damage, those secondary insults, while we get them where they need to be. And honestly, some of it might seem surprisingly basic.
Really? Like what? Give me an example.
Well, for example, just something as simple as keeping the patient's head and neck in a neutral position.
Yeah.
Sounds simple, right? But think about it. Any twisting or turning of that head and neck, you could be compressing those vital veins in the neck, the ones responsible for draining blood away from the brain. We absolutely do not want anything that might back up the system, so to speak.
So good old-fashioned alignment, that's key.
Yeah.
What else falls under this whole brain-focused therapy umbrella?
They also talk about elevating the head of the bed somewhere between 30 and 45 degrees.
Right, which is pretty standard practice, isn't it, even outside of TBI?
Yeah.
What makes it so crucial in this scenario?
Well, think of it this way. By elevating the head, we're using gravity to our advantage, encouraging blood flow out of the skull. It can also help regulate the pressure of the cerebrospinal fluid, that fluid that cushions the brain.
Right, right. So it's another way to keep that pressure from building up and causing more damage.
You got it. Now, there is some debate, and I'm sure we'll get into this more later, about how this head elevation might affect things like blood pressure readings, depending on where those monitoring devices are placed. But the overall goal here, the big picture, it's about creating the best possible environment for healing within that skull.
Makes sense. It's all about finding that balance, right? What other factors are they focusing on?
Temperature control, that's a big one. Keeping that patient's temperature within a very specific range, that's critical.
Because I remember you mentioning that fever after a TBI. That's bad news, right?
It can be, yeah. A fever kicks the brain's metabolic rate into overdrive. It basically means that the brain needs even more oxygen and nutrients to function properly. The problem is, after a brain injury, the blood supply is often, compromised, to say the least. So a fever, that can actually make the damage even worse.
So we're protecting the brain from that extra stress.
Exactly. And it's not just about preventing fever. We also have to worry about the flip side, hypothermia. When the body temperature plummets too low, that can really slow down the healing process, and it can mess with blood clotting, which, as we know, is a major concern with these injuries.
Right, right. We touched on that earlier. Okay, so we've got temperature. What about the other stuff, like blood oxygen levels, blood sugar? Do these papers get into the weeds on those too?
They do. They recommend specific targets for blood oxygen saturation. We've got to make sure that brain is getting enough oxygen. And yeah, they also stress how important it is to keep blood sugar within a normal range.
Okay, so why is blood sugar so important when we're talking about a brain injury?
Well, both high and low blood sugar can really throw a wrench into the recovery process. High blood sugar, what we call hyperglycemia, that can actually make brain swelling worse and increase the risk of other complications. And then on the other hand, low blood sugar, or hypoglycemia, that starves the brain of the energy it needs to heal. So we've got to find that sweet spot.
It's like that with so many things, right? Finding that Goldilocks zone, not too hot, not too cold, but just right.
Exactly. And it just goes to show that TBI management, it's not just about addressing the injury itself. It's about understanding and managing the body's entire response to that injury.
It's like this domino effect. The injury triggers this chain reaction in the body, and we have to manage every single step in that chain really carefully to give the brain the best chance of bouncing back.
That's a fantastic way to put it. And these papers, they do a fantastic job of really laying out those steps, those critical interventions and targets. That can make such a difference, especially in those first few hours after the injury.
Now, I remember you mentioning earlier that there aren't really any medications out there that have been proven to protect the brain from damage after a TBI, which I have to admit surprised me a little. You hear about all these promising new treatments in the news all the time.
You do. But the unfortunate reality is that while there's a ton of research going on right now exploring all kinds of potential neuroprotective therapies, when it comes to those really large-scale trials in humans, none of them have really panned out. Not consistently, at least.
So until that magic bullet comes along, what do?
We focus on what we know works, right? Managing those secondary injuries, like we've been talking about, optimizing that brain's environment, and providing really, really good supportive care. And that's where these papers are so valuable because they provide this practical guidance based on the best available evidence.
It's like we're clearing the path, removing obstacles,
Yeah.
so the brain can do what it does best, which is, well, heal itself.
Exactly. Now, that being said, while we wait for those medical breakthroughs, there are surgical interventions that can quite literally mean the difference between life and death.
Right, of course. So let's talk about the surgical options. What are the main types of surgery that someone might be considering for, a severe TBI?
It all depends on the injury itself, of course, but two procedures that come up time and time again are, one, evacuating what we call mass lesions, and two, performing what's known as a decompressive craniectomy.
Okay, let's break those down one at a time.
Mhm.
What exactly is a mass lesion, and how do you go about, evacuating it?
So imagine like a pool of blood putting pressure on the brain. That's basically what a mass lesion is. It could be blood between the skull and the brain, or even bleeding within the brain tissue itself.
Yeah.
And evacuating it, well, that means surgically removing that blood to relieve the pressure.
So it's like draining that pool of blood to give the brain some breathing room.
Exactly. The decision of whether or not to operate and how urgently they need to get in there, that depends on a lot of factors. We're talking about the size of the bleed, the location, the patient's neurological state, whether it's causing the brain to shift or become distorted.
Because if it's big enough, that bleed, especially in a really critical area, you're talking about potentially irreversible damage.
Right, and that's when surgery becomes essential. Now, that other procedure I mentioned, that decompressive craniectomy, it's a bigger deal.
Okay. Decompressive craniectomy. Yeah, that sounds pretty intense, I'm not going to lie.
It is a more significant procedure. It's usually reserved for situations where you've got really severe brain swelling. Imagine the skull, it's like this fixed container, right? And the brain, well, it starts to swell. That pressure, it builds up so quickly, and it can be incredibly dangerous if it's not addressed.
So in that situation, what do? You can't exactly, make the skull bigger.
Right. So with the decompressive craniectomy, the surgeon actually removes a portion of the skull bone. They create more space for that swollen brain. It's all about relieving that pressure, preventing the brain from basically crushing itself.
Wow, it's literally like creating an escape hatch for the brain.
That's one way to put it. And it can be life-saving, especially when you're talking about swelling so bad that it's life-threatening. But even with a procedure like this, there are a lot of ongoing debates and discussions in the medical community.
Like what? What are surgeons debating about when it comes to something as serious as this?
Well, for one, there's the question of how much bone to remove. A larger removal that's more effective at bringing that pressure down, but it also comes with a higher risk of complications down the line.
So it's all about weighing those risks and benefits.
Yeah.
And in a situation like this, time is of the essence, right?
Absolutely. The surgeon has to make these judgment calls in these really high-pressure situations. And then there's also the question of when to do it. In some cases, it's an emergency, got to get in there now kind of thing. But other times, it might be more of a later step if the swelling isn't responding to other treatments.
It's just there's so much to think about even before you get to the recovery phase. And that's why I'm really glad we're doing this deep dive.
Me too. I think these procedures, they highlight just how complex severe TBI is and how important it is to have these ongoing discussions and debates within medicine to make sure we're providing the best possible care.
Speaking of those discussions and debates, I noticed that these papers mainly focus on blunt force trauma as the cause of these TBIs. Are there other types of head injuries where the approach, the management might be different?
That's a really great point. You're right. These papers, they focus primarily on blunt force trauma, which makes sense because it is the most common cause of TBI, but they don't really get into things like penetrating head injury.
Penetrating, so we're talking about like gunshot wounds, that kind of thing.
Exactly. And those come with a whole other set of challenges. For example, the risk of infection, that skyrockets when you're talking about something that's pierced the skull and entered the brain.
Yeah, that makes sense if something from the outside has gotten in.
Right. So infection control becomes absolutely paramount. And then you've got the potential for damage to the blood vessels within the brain, which of course can lead to more bleeding and a whole cascade of complications.
So you're not just treating the initial injury, you're also trying to stay one step ahead of everything else it could potentially trigger.
Exactly. It's like this multi-layered puzzle. And managing these types of injuries often requires this whole team of specialists. You might have neurosurgeons, trauma surgeons, infectious disease experts, maybe even plastic surgeons, depending on the damage. It really takes a village.
It really speaks to the complexity of the brain. And and really TBI in general, right?
It does. And while there are definitely some similarities in how we approach blunt force versus penetrating injuries, those differences, those nuances, they highlight how crucial it is to really tailor our approach to each individual patient. There's no one-size-fits-all solution here.
Makes sense. Now, I noticed that throughout both of these papers, they emphasize avoiding what they call secondary insults to the brain. Can you unpack that a little bit? What does that even mean?
It's about protecting the brain from any further damage after that initial injury. Think of it this way. You wouldn't, punch someone who's already doing right. Secondary insults are basically those extra punches to an already injured brain.
Okay, I like that analogy. So what are some examples of these punches? What kinds of things are we talking about?
Well, we've touched on a few already. Things like low blood pressure, those dips in oxygen levels, high carbon dioxide in the blood, fever, like we talked about earlier, and even seizures. Those can be a secondary insult.
And all of this can happen after the initial head injury. So it's not just about those first few minutes.
Unfortunately, no. They can happen in the minutes, the hours, even days following the trauma, and they can have a huge impact on how well the patient recovers.
How so? Can you give me an example?
Sure, let's say you've got someone with a TBI and their blood pressure suddenly tanks. Well, when that blood flow is reduced, the brain isn't getting the oxygen it needs, the nutrients it needs to heal. And that can lead to even more damage. It's a vicious cycle.
So the injury leads to these secondary insults, which then make the injury worse.
You got it. And that's why managing those secondary insults, that's really at the heart of TBI care. We've talked about some of those strategies already. Maintaining that blood pressure, making sure they're breathing properly, controlling that temperature, even using medications to prevent seizures if we need to. It really is a team effort. Everyone involved in that patient's care, they have a role to play in protecting that brain from those extra punches.
Okay, that makes a lot of sense. Now, another term I keep seeing in these papers is coagulopathy, which I'm guessing has something to do with blood clotting, right?
That's right. Coagulopathy basically means there's something off with the blood's ability to clot properly. And it's a huge deal in TBI for a couple of reasons. First, the injury itself can mess with the body's natural clotting mechanisms. And second, you've got to remember that a lot of TBI patients, especially older folks, they might already be on blood thinners for other health issues.
Oh, wow. So it's like a double whammy.
It can be, yeah.
Yeah.
And it can lead to more bleeding, a higher risk of those hematomas we talked about earlier. So managing that coagulopathy, that's absolutely critical.
Okay, so for those of us who aren't, hematologists, what are the key things we need to remember about managing those blood clotting issues in the context of a TBI?
Well, the first thing is we've got to know if there's a pre-existing clotting issue. Was the patient on blood thinners before this happened? If so, which ones? Because the approach can be really different depending on the specific medication.
Because different blood thinners require different approaches.
You got it. For some, like warfarin, for example, rapid reversal, that's the name of the game. And that often involves using something called prothrombin complex concentrate, or PCC, along with vitamin K. But for others, like the newer DOACs, there might be specific reversal agents available. It all depends.
So again, it's all about individualized care, knowing the patient's history.
Exactly. And sometimes it might mean calling in a hematologist, a blood specialist, to help figure out the best course of action. But it's not just about what the patient was on before the injury, right? We've also got to deal with the clotting problems that can pop up because of the TBI itself.
Right, because you said that the injury itself can make it harder for the blood to clot properly.
Exactly. That injured brain tissue, it can release all sorts of substances that interfere with clotting. And the body can actually use up its clotting factors trying to control the bleeding at the injury site. It's like this whole cascade of events.
Okay, so how do you address that? How do you replenish those clotting factors?
Sometimes it's as straightforward as giving them a transfusion, replacing those depleted factors. Other times, we might need medications that give clotting a boost, or even platelet transfusions.
So again, not exactly a straightforward, easy answer.
You got it. It's complex, but these papers do a good job of giving us a framework, of reminding us to think about coagulopathy in this really comprehensive way when we're dealing with TBI.
It's amazing to me how much goes into managing these injuries, how much detail.
It's a lot, and honestly, we've only scratched the surface.
Well, luckily for us, we've got a little more time to dive in. What else can you tell us? Okay, so we've talked a lot about those initial hours after a severe TBI, all those split-second decisions that have to be made. But what about what's the word I'm looking for, the long game? What happens after that patient is stable, after they've made it to that hub hospital? What should people be prepared for as they navigate that road to recovery?
That's a really important question, and it's something these papers do touch on, toward the end. And it's where things get, well, they get a little less black and white. We go
Right.
from those life or death decisions to a whole other world of care. TBI recovery, it's rarely a straight line. It's more like, I don't know, think of it like a winding road, lots of hills, curves, good days, bad days.
So setting realistic expectations for both the patient and their loved ones,
Yeah.
that's got to be a big part of it, right?
Huge. And one of the biggest things to remember is that every brain injury, it's unique. The way someone recovers, it depends on so many factors. How severe the injury was, the person's age, their overall health before the injury.
So you can't really say, okay, you'll be back to normal in 6 weeks, or it'll take about a year to recover from this. It's just not that simple.
Exactly. There's no magic timeline. Some folks might bounce back relatively quickly and smoothly, while others, it might be a much longer, more challenging road. And everyone's experience is going to be different.
So what are some of those hurdles, those bumps in the road that someone might encounter along the way?
Well, like I said, it can really vary, but we see a lot of the same things pop up. On the physical side, you might have problems with things like, walking, balance, coordination, that sort of thing. Cognitively, we're often dealing with memory issues, difficulty concentrating, trouble processing information quickly. And then, of course, there's the emotional and behavioral component, which can be really tough.
I bet. Imagine that's something that a lot of people don't really think about until they're in the thick of it.
You're right. It's a big one. Because we're not just talking about physical symptoms. Imagine you're dealing with these wild mood swings. You're more irritable than usual. You might even feel like your personality has changed. And that's common, those changes. It's the brain trying to heal, trying to rewire itself. But it's incredibly difficult, not just for the person going through it, but also for their loved ones.
So it's not just a physical injury. It affects the whole person, their entire world.
Got it. And that's why having a strong support system, that's crucial. People need to be surrounded by people who understand what they're going through, who can offer that, that unwavering love and support.
So when we talk about support, what are we talking about specifically? Who are the key players on that support team?
Well, it's really a multidisciplinary thing. On the medical side, you've got physical therapy, which can be great for those physical challenges, regaining strength, improving mobility, all of that. Occupational therapy, that focuses more on helping people relearn those everyday tasks that honestly we all take for granted. Things like getting dressed, cooking, managing money.
It's about giving people back their independence as much as possible.
Exactly. And then you've got speech therapy, which can help with any communication difficulties. Cognitive rehab, that's designed to work on those thinking skills, those memory challenges. And of course, we can't forget about counseling or psychotherapy.
Right, because there's that emotional component to all of this, too.
Absolutely. People need a safe space to talk about what they're feeling, to learn those coping mechanisms, to process the trauma. And that's important not just for the individual, but for their families, too.
Now, you mentioned cognitive issues earlier. Can you give me some specific examples of those? What kinds of cognitive challenges might someone face even after they've, physically recovered from a TBI?
Well, memory problems, those are probably the most common. But people can also struggle with attention, with concentration, even with something we call executive function.
Executive function. Okay, I'm not going to lie, that sounds important. What exactly are we talking about there?
It's basically like the CEO of your brain, right?
Yeah.
It's the control center that handles planning, organizing, managing your time, making decisions, all those higher level thinking skills that we use every single day without even realizing it.
So when that part of the brain is injured, it can really throw a wrench in someone's life. Even if they seem physically fine, those cognitive challenges can be really debilitating.
Exactly. Even simple things, things that they used to do without even thinking, they can suddenly become incredibly difficult. Frustrating, too.
Are there things that can be done to help with those cognitive issues? Is it possible to, I don't know, retrain the brain, so to speak?
That's what cognitive rehabilitation therapy is all about. It's designed to help people develop new strategies, workarounds, to help them regain those skills or find ways to compensate for those that might be permanently impaired.
So in a way, yeah, you are kind of rewiring the brain, teaching it to function differently.
That's a good way to put it. And one of the things that gives me so much hope in these situations is the brain's plasticity. Its incredible ability to adapt and change even after a serious injury.
That is encouraging.
No.
Now, I know we've talked about how important support is, but even with the best support system in the world, recovering from a TBI, I imagine it can be incredibly emotionally draining.
Absolutely. It takes a toll. And even though these papers focus mostly on the medical management of TBI, they do acknowledge that emotional and psychological impact.
Which, as we've been discussing, is a huge piece of the puzzle.
Hmm.
So what are some of the, I guess, the more common emotional challenges people might face after a TBI?
Well, anxiety and depression are big ones. Not surprising, given everything else that's going on. But we also see a lot of mood swings, irritability, anger management issues, and for some, it can even lead to post-traumatic stress disorder, PTSD.
So again, it's not just about healing the physical injury. We've got to address that emotional and psychological healing too.
100%. And I think the most important thing is to remember that those emotional responses, they're normal. They're not a sign of weakness. They're just the brain's way of trying to make sense of what happened, of coping with the trauma.
So if someone's struggling with those emotions, what's a good place to start? How do you even begin to process everything that's happened?
I think the first step is just acknowledging those feelings, allowing yourself to feel them, without judgment, and then talking about them, whether it's with friends, family, a therapist, a support group. Just getting those feelings out in the open, that can make a world of difference. And sometimes medication might be appropriate. Things like antidepressants or anti-anxiety meds, they can be really helpful for some people. It all depends.
So like we keep saying, it's not a one-size-fits-all approach. It's about finding what works for that individual.
Absolutely. And it's not just the patient who needs support. Their family, their loved ones, they're going through this too. And for them, it can be a huge adjustment.
Yeah, because suddenly you're not just a spouse or a parent or a child, you're also a caregiver. And you're trying to navigate these changes in your loved one, and it's not always easy.
It's incredibly tough. And that's why it's so important for family members to educate themselves about TBI, to understand that the changes they're seeing, those mood swings, that irritability, that forgetfulness, a lot of times that's the injury talking. It's not the person they love trying to be difficult.
So knowledge education, that can go a long way in fostering compassion, in having patience.
Couldn't agree more. And it's crucial that those caregivers, they remember to take care of themselves too. It's so easy to get caught up in the demands of caring for someone else that you forget about your own needs. But burnout is real and it helps no one.
So self-care for the caregivers, that's a prescription I can get behind.
Absolutely. Whether it's support groups, respite care, just taking an hour a day to do something they enjoy, whatever it takes to recharge and avoid burnout. That has to be a priority.
Now, before we wrap up this deep dive, I wanted to circle back to rehabilitation. Can we talk a little bit more about what that looks like in practice? I mean, we've touched on some of the different types of therapy, but what are we really talking about when we say the word rehabilitation?
It's all about helping people regain those lost functions and abilities, those skills that might have been affected by the TBI. Or if regaining them completely isn't possible, it's about finding new ways to adapt, to adjust to those limitations. Ultimately, it's about giving people back their independence, helping them live their best possible life after a TBI.
So what does that look like? We talked about physical therapy, occupational therapy, speech therapy, cognitive rehab. Are there other types of rehabilitation that people might not be as familiar with?
Yeah, one that often gets overlooked is vocational rehabilitation.
Vocational. So that's about like helping people get back to work.
Exactly. It's this whole area of rehab that focuses on helping those with TBIs return to work or maybe even explore new career paths. Because the reality is, a TBI, it can have a huge impact on someone's ability to do their job, either temporarily or, unfortunately, sometimes permanently.
So a vocational rehab counselor,
Yeah.
they could help someone, I don't know, figure out what other jobs they might be good at, jobs that play to their strengths.
Exactly. Or they might provide some training, help with job placement, maybe even work with potential employers to make adjustments to the workplace so it's more accommodating. It's really about recognizing that a brain injury, it doesn't have to be the end of someone's career. It might mean making some changes, trying something new, but that doesn't mean they can't have a fulfilling work life.
That's so important for people to hear. Wow, this has been, I don't know what else to say. This has been incredible. We've covered so much from those like really scary, intense first moments after an injury all the way to this, this long winding road of recovery. It's a lot.
It is a lot,
But
but it's inspiring in a way. It speaks to the complexity of TBI, but it also speaks to the incredible resilience of the human brain and the human spirit.
it does. So if you had to boil it all down, what would
Yeah.
you say are the most important things for our listeners to take away from this deep dive? What do you really want them to remember?
I'd say the biggest takeaway is that even though TBI is incredibly complex, hope is not lost. Yes, it's incredibly challenging, both for the person who sustained the injury and for their loved ones. But with quick, appropriate medical care, ongoing support, and a commitment to rehabilitation, people can make incredible recoveries. And they do every day.
That's a powerful message. And it's a testament to the incredible work being done every single day by so many people. The doctors, the nurses, the researchers, the therapists, and of course, the survivors themselves and their families. Their strength and resilience is truly inspiring.
I couldn't agree more.
Well, thank you from the bottom of my heart for joining me on this deep dive today. Your expertise is invaluable.
My pleasure. It's always great to be here.
And to our listeners, thank you for joining us on this exploration into the world of severe TBI. We hope you learned something new today, that you feel a little more equipped to navigate these challenging waters. Until next time, keep learning, keep asking questions, and as always, keep diving deep.